Hi
So hi
everyone.
everyone, and we just did a video day before yesterday where we talked about how can we convert the delayed NEET PG into an opportunity. And since then, Sumit, we've been getting a lot of messages from some students who really weren't preparing so far, but because the exam has got significantly delayed, they wanted to especially ask how should we proceed. Can you please charter out a plan for someone who wasn't studying so far for NEET PG but now wants to give a serious attempt for the exam? And before you start telling them about what they could do and how we can utilize things and time, uh, the first thing that I want to begin with is that I do understand that for whatever reason you might not have considered yourself as a candidate for NEET PG. Maybe your circumstances, maybe you were doing a job, maybe you had some other commitments. But definitely now, because there is a delay, your first question with which you start your sentence is, do you think there is time for me to think of myself as someone who can give the exam? So, a
Definitely
big,
yes.
big yes, there is enough time. We're not just saying this to console you, but any fresher, even when there is no delay and somebody asks us what is the approximate time for a post intern or someone who's outside of their MBBS curriculum now and wants to prepare and give a serious attempt for NEET PG, I think 6 to 7 months is appropriate time, right? So that is the kind of time we have from now onwards until the prescribed date for the exam. So please do not rule yourself out. Do not think that you're going to do a compromise in any which way. As I said, the time is enough even to start from scratch, build concepts, do MCQ practice, and even revise in the end and give a good attempt for the exam. So, Dr. Sumer, let's begin with you now on what your take is and how they could utilize especially the Ultimate App Live course.
Now let's now start with the first thing that Dr. Deepthi has already said. That first thing is, let's believe in the possibility that you can do it in the
Yes,
remaining months. It is enough
absolutely.
time. This delay is a opportunity for you.
Yeah.
And I've seen many people, what they do is, whenever they see an opportunity, they get confused and they start thinking, is it possible, is it possible, is it possible, and you keep asking, is it possible, for
Or
the next 3 months, and
yeah,
then
and
it
and
will become
suddenly
impossible.
yeah, and suddenly
Okay,
you've lost the
you, if
time.
you keep asking, is it possible for the next 4 months, then the answer will
Yeah,
become impossible.
yeah.
Today it is possible. Okay, I am again saying it, don't
And
ask it
possible
again.
without
दोबारा मत
compromises.
पूछें, अभी possible है, बहुत ज़्यादा पूरा time है. Okay, second thing. Second mistake that many people do is when the exam is delayed, because we are doubtful of what to do, what not to do, they spend too much time on thinking what would be the right resource for me. And then what happens is, because spending too much time on resource finding, you are wasting that precious time. And instead of 7 months, now that time become 4 months. My suggestion to you is, and the course that I strongly recommend from DAM's portfolio of courses is the Ultimate Life course. I have three reasons for it. Number one is, when you are starting at this juncture, I'm sure you are starting late.
Yeah.
So, there must be some reasons, there must be some lacunae that you need to work on, there must be some concepts that you need to build on, and you need someone to handhold the entire process. Ultimate Live course is the revolutionary edtech online course that has ever been created in NEET PG segment. This course has a daily, every day, 4 to 5 hour live class. Easily doable, with discipline, interactive, with teacher, doubt solving. So
Okay.
every day a period of your time is being given to the teacher, with the teacher. It is as good as a home tuition,
Okay.
because
Before
through the phone the teacher is coming into your phone.
Yeah, before Dr. Sumit tells you more details about the course, he said a very good point. Why would we need something with hand holding now? Because I believe, and I'm sure that is the case in most of the scenarios, that when you were not giving the earlier exam, as I said, there must have been certain binding circumstances, maybe family issues, maybe job or personal issues, which means there was a gap, right, between your preparation and what the exam requires, right? And we need to fill the gap. When we need to fill the gap in a stipulated period of time, bhai aisa to nahi hai ki we have like 5 years or आराम se karna है, ऐसा नहीं है ना. So when we have to fill the gaps in a stipulated period of time, We need experience, we need expertise, we need you to know in what pattern or format do you need to know things. It's not that you don't know anything. You've been through your MBBS, you're good doctors, you have a good aptitude, but what the exam requires is something different from just pure knowledge, right? It has to be application, it has to be to see when you know a paragraph, but do you really know how to apply that in practice or in MCQs or when a clinical vignette comes. And that's why he and me, we always press on that when there is a gap in your understanding and what the exam needs, it's better to have someone to tell you exactly what you need to know, right?
And this entire question that should I go for a recorded course or a live course, which can be finished faster? In your mind, initially you will think that if I buy Back to Basics, which is the DAMS recorded course, you might think that, okay, I just need to buy it and then it is done. No, then that is the exercise of buying which is done. The exercise of studying will take time. And while on an ultimate live course, it might feel that, okay, it will take time, but actually there is someone hand holding you through the entire process. You just need to passively start the lecture, attend, ask doubts, answer. You're part of a curriculum. So first thing you need is a curriculum, you need a system. And I believe ultimate live would be the game changer for the late starters this year.
And
But
we have revamped Ultimate App Live because, the sole purpose is not to give you gaps. And that's how we decided on the OD dose.
yes,
Let it be smaller bursts, but let
every
it
day.
be every day, right? So it's not like you have to sit for long hours. It's smaller sessions, but every day. So जो चाहिए अभी वो ना कंसिस्टेंसी है. मैंने पिछले वीडियो में भी ये बोला था, and I'm going to repeat it again. More than the acceleration in your preparation, fast पे नहीं हमें जाना चाहिए. हमें इस वक्त acceleration नहीं चाहिए. Different times need different strategies. So when you begin with a 6-month time in hand, it's not acceleration, it's rhythm, it's consistency, it's diligentness that we need from your side कि हम रोज पढ़ेंगे no matter what, चाहे 4 घंटे पढ़ें पर रोज पढ़ेंगे.
Now let's go deeper into it. Now every day 5 p.m. your time is set with us. 5 बजे का डेट अपने साथ हो गया आपका, है ना? 5 बजे रोज लाइव क्लास कर रहे हैं. Sir, when will I read those notes again that I'm writing
That's
in
what I
those
was going to
5
come to.
hours? After 10 p.m., 10 to 12, give the time for same day reading of the notes. But I'm going to come to the second part of which will be the game changer for you. In your ultimate life, you get access to DQB GOAT edition. If
In
I
fact,
was in
everything
your
you
place,
get access
if
to.
I was in your place, in the morning time, I would do 100 questions from DQB GOAT of the subject that is ongoing in the ultimate
and
life
especially the
course.
topics which have been covered.
या दोबारा सोचते हैं. So suppose you are attending ENT with us. So in this week, every day you are attending ENT class. In the morning, you are doing GOAT edition DQB ENT questions.
Yes.
And the important thing about the GOAT edition is, I'm sure you already know it, it is India's only question bank which comes with video solution. So now what I want you to do is, after each question, there will be a 1 minute or maybe a snippet, a few lines that a teacher will say, which will build your auditory memory, which will be your mantra, which will tell you, okay, this is the key to this question, and your MCQ skill will increase many fold faster. You understand? Suppose you don't do anything in this 6 month, and suppose you do it with ultimate live course, it is just like reaching to a place on a Ferrari car. Now you have so much assistance with you. Every time somebody is telling you ऐसे नहीं ऐसे करना है, ऐसे नहीं ऐसे करना है. So now this will build up your MCQ practice.
एक और खास बात भी है इसमें, sometimes you are asking us, ma'am, with this course, when will I get time to revise, or when will I do what you are doing in the class? So the beauty is, when you attend the class live, okay, and you're listening to the teacher, you're asking your doubts, you're making your notes, or maybe using the handwritten notes, but when you solve the questions side by side, it is like a repeated hammering. The retention is higher, the number of doubts or queries that you have reduce automatically. And you will realize कि कल आपने टीचर से सुना था और आज वही बात MCQ में दोबारा सुनी है. It is more likely that you will, it will stay with you for a longer duration. So जो आप रिविजन को बाद में सोचते हो ना, वो साइड बाय साइड शुरू हो रही है. So
और कोई ना डाउट का चक्कर भी नहीं रहता, क्योंकि वो डाउट तो वहीं टीचर ने सॉल्व कर दिया ना, वहाँ वीडियो हमने डाल दिया. इट इज अनलाइक एनी अदर ऐप दैट यू यूज सो फार. सब में ना आप बहुत सारे डाउट बच जाएंगे करने के बाद भी, और कई ऐसे पढ़ के भी डाउट बच जाएंगे. यहाँ तो डायरेक्ट टीचर का आंसर सामने रहेगा. तो अब क्या होता है, नाउ इमेजिन, सपोज यू आर फॉलोइंग माई फॉर्मूला, Not, you're not using your brain, you're trusting the system, you're trusting the teachers. Very, very
The
important.
process
Because
actually.
if you trust the process, you can become faster. Otherwise you take time to build trust. 3-4 महीने ऐसे निकल जाते हैं, एग्जाम सर पे आ जाता है. We need to trust immediately, race to trust. Now every day you're attending classes with the teacher, doubt solving, concept building, after the class reading the notes themselves, building up your memory. Every day maybe 2 hours for 100 questions. Now I'll show you mathematically and prove it to you. 100 questions every day into 30 days becomes 3,000 questions, into 6 months becomes 18,000. Your entire DQB is done.
Yeah.
And you are 18,000 questions with video solutions done in your mind, all lectures attended live, interactive with teachers. Who is going to stop you? Now only thing that is left is your exam skill and revision. If I was in your place, I would build a discipline in my mind that as soon as in the ultimate life course a subject is over, I will submit my class test.
Very essential. Right. So, at DAMS, we always tell students that we give 4 levels of testing. So, you have to listen to me very carefully. DQB is not a testing format. Okay. DQB is practice format. DQB is application of what you have read, how much you can retain, what points are very important, right? But now, what about the testing part? Because that is where the analysis of your, level comes in. So, we have 4 levels of testing. The first level of testing is your class test, which is purely based on what has been taught in the class. It will ensure that you're aware of the most important topics, the most probable topics, and the most probable questions from the topic based on the current pattern of the exam, right? The class test is something which should be done once you are through with the subject. For example, you finish obstetrics with me, you will see that within your course, right, in the test series section, you will have a class test category and you will have an obstetric class test uploaded. The beauty is that even with class tests, we are giving you video solutions. So I will be explaining the questions, not the way I have done it in the class. The format is different now.
It will retrograde.
Right? Yeah, because तब मैं आपको पढ़ा रही थी, I was teaching from scratch. अब मैं आपको सिखा रही हूँ कि जो मैंने पढ़ाया है उसको apply कैसे करना है. Right, so that is the first level of test, which is class test. Smaller number of questions, but it is the most probable and the most important things. The second level of testing becomes the SWTs. They are subject-wise test. So your first doubt at ma'am, is it different from the class test? Yes. How? Let's see. So this will be now much bigger number of questions, around 200 questions, especially for the bigger subjects like medicine, surgery, OG, and so on. So in this, our goal in the SWT is to cover last 5 to 7 years of MCQs of exams, right? So the SWT will ensure कि previous year questions जो हैं, जो pattern थोड़ा अलग भी था, but you should be well aware that this is what has been coming in the exam over last 5 to 7 years. They also come with video solutions. And SWT is a test which can be given at a little gap, okay? So it shouldn't be given immediately. So immediately you give the class test. Let's say after 1 month you want to revise. अच्छे मुझे तो अब याद ही नहीं है. Now instead of straight away going to your notes, give the SWT first. So it is for spaced revision. And as I said, it comes with video solutions. The next 2 levels of testing, I'll let Dr. Sumay let you know.
And in the next 2 level, the most important is the grand test.
Yeah.
And sir, abhi to sir, I'm starting late. How can I give grand test? I'll tell you a formula. Every month till March, January, February, March, you appear for 1 GT every month. Then in April and May, I want you to increase the frequency to 2 GTs every month. In June, go with 4 to 6 GTs. So in June, you will increase the number of GTs. So this will help you to side by side parallel keep assessing yourself. In the GT, there are only 2 things to remember. Only look at your number of corrects.
Yeah.
Your target should be, I should be consistently above 120 correct. That should be your target.
Yeah, at least
if you are not there, don't worry, you are progressing. You're starting your journey in January, you are progressing.
Yeah.
Just keep giving the grand tests and listen to the video solutions of the grand test. DAMS is the only platform where we have video solutions for every question. So
not just that, our grand tests are not biased. They are not based on DQB. तो ऐसा नहीं है कि DQB के ही question उठा के दोबारा
You can't simply do them on recall. You will have to analyze. You will have to analyze the.
They are made by the faculty.
Like
every month's GT is coming from the faculty, respective faculty, with videos. They record it. They know what they are asking. They know the pattern. They are making it fresh with the current pattern. Also, since Dr. Sumer has mentioned about the grand test and video solutions, I will also talk about the analysis part, because somehow I have seemed to master it. So the 3-column strategy is a must do right from the beginning. There is a separate video which I did for 3-column strategy. I'll just give you in a brief what I want you to do. So the analysis of the GT is super important. The analysis has to be based on every subject, and in every subject we make 3 columns. The first column is very specifically the names of topics, not question and answer. I'm not asking you to write the question, write the answer. No. I'm not asking you to repeat your notes as well. We're not increasing your workload. Just very specifically the name of the topic that you have done wrong in the first column, because this first column of wrong topics is super important. Between one GT and other GT, we want you to revise as many these specific subtopics as you can. The second column is going to be a column for volatile things, because sometimes you just forgot it because it was a value-based question, an IOC, an organism, right? So those you can write there itself. So this also becomes your 20th copy. You don't have to really create another one. So your analysis copy becomes your 20th copy. It will be very, very useful for ongoing evaluation as well as for revision closer to the exam. Coming quickly to the third column, the third column of the 3-column strategy is new topics. This is a column that we beware of, which means I'm not going to add a lot of things. I'm not doing research. I'm not doing MD in 19 subjects. Very specifically, okay, agar koi aisi cheez GT mein aayi hai, which you feel you have not read before, it's new for you, then yes, write it there. Listen to what the faculty has said, and that's enough. Don't start doing a Google search on it. There's no point wasting a time on unique or uncommon things. They're uncommonly asked. So that's the 3-column strategy. Always follow it, especially for grand tests. You can use it for the other tests also, but it is especially useful for GTs. Okay.
And there are CBTs, which are the fourth column of the fourth pattern of our, step of our testing system. CBTs are different from a grand test, which you do in the comfort of your home and a mobile phone.
Yeah.
Grand test, do it at your home. While CBT, you will do in a computer center, which will be designated for you, just like a real exam.
Right.
You'll go to exam center, you will be checked, and you'll give an exam like a simulated exam. So this year we will be doing a CBT in January 17th, then February. Then in June we will do again 2 CBTs before the NEETPG exam.
We'll also do a CBT before INI.
We're planning to do it.
Yeah,
and plus we're planning to do mock test on the eMedicoz app, all India level, which will give you mock test for NEETPG and the INI exam both. So what you want to do is, if I will now give you a nutshell of the entire strategy, just keep in mind that for revision you will use DVT. So in the June, you will use the DVT book, one reading with the teacher, with the workbook, then multiple readings of the DVT workbook filled up. Now I'll revise everything for you and will summarize.
अच्छा, अभी पहले summarize करने के लिए best तरीका क्या होता है कि for any exam there are 3 important components for your preparation. There is content building, there is MCQ skill, and there is revision. Right? So Dr. Sumer, what is the thing that we have asked them to do for content building?
So for content building, you will do everyday live class without fail. You will not miss any lecture.
Okay.
From 10 to 12, you will read it once more to reinforce.
And in the morning before your class, you will do the DQB, okay, which is to assess how much
hours,
you can.
100 question target, 2 hours, GOAT edition with the video solutions, and you will do the questions of the topics which are ongoing in the class itself.
Okay, since I'm talking about content building, I always think like students, and then a doubt comes to me, okay, if radio is going on and I really want to do something else also with it, then you have access to entire back to basics video lectures as well. Suppose आपने कुछ रेडियो में पढ़ा है, लेकिन वही चीज आपको सर्जरी में जाके देखनी है कि वहां पे क्या बताई. It's a good idea to go and look for that particular part in that particular lecture. So you have recorded video lectures also in case you want to accelerate from your side, or you want to refer a particular topic from another subject at the same time. So this is what we need you to do for your content building.
And also remember that, every day, suppose you start at 7 a.m. in the morning, which is a fair ask. So 7 to 9, you're doing DQB.
Yeah.
And 5 to 10, you're doing the ultimate live, and 10 before sleeping, you're just revising what you studied in that day. So you have a big chunk of time every day from 9 to 5, which is where you have already done your MCQs and your concepts are taken care by the live classes. In the 9 to 5, we want you to use that time for tests. In that time, first you will do class test. After a gap, like Dr. Deepti said, you will do the SWTs, monthly GT in the initial phase, then bi-monthly, then 4 times a month, then 8 times a month. You try to increase the frequency of grand test. You will use the 9 to 5 time for testing. And in the last month, this time will become more and more for your DVT revision. So with this, you will, in different zones, you will be touching different aspects. You will be touching topic-wise MCQ practice, testing, concept building, same day revision.
And maybe, when you listen to us, you feel, अच्छा इतना सारा पढ़ना पड़ेगा, तो answer है yes. We are not
19
here.
सब्जेक्ट है, MBBS कर रहे हैं, थोड़ा तो पढ़ना
We are
पड़ेगा.
not here to simply give you a rosy picture. The picture
नहीं,
is
वो 3 दिन वाले बहुत सारे लोग पढ़ा रहे हैं, उससे होगा नहीं.
नहीं, definitely the picture
होगा
is
नहीं.
rosy, but who makes it rosy is not us. It is you yourself by putting in all the hard work. See, a farmer can bring out a good produce from his farmland by tilling the land day and night, by putting manures, fertilizers, watering it, right? And taking care of everything. So which means you put your heart and soul into it. Similarly, if we have to start something, we should start with full commitment.
मतलब हम लेट शुरू कर रहे हैं या
और
हम
उसको
अभी
भी
जनवरी में शुरू कर रहे हैं, तो हाफ
half-heartedly
हार्टेड करेंगे तो हाफ हार्टेड रिजल्ट आएगा. लेकिन अगर हम पूरा इस समय एक पूरा फोर्स लगा देते हैं तो इट बिकम्स एन अपॉर्चुनिटी. इट इज डेफिनेटली एन अपॉर्चुनिटी. देयर इज एनफ टाइम. ठीक है, हो सकता है और 2 महीने मिल जाते हैं, आप और अच्छा कर लेते हैं. हो सकता है और 3 महीने मिल जाते हैं, लेकिन हो सकता है 2 महीने और कम मिलते हैं. अब क्या कर सकते हैं, जितना है उतने में ही करना है. ये टाइम बहुत बढ़िया मिल रहा है. इफ यू आर स्टार्टिंग नाउ, इट्स अ गोल्डन अपॉर्चुनिटी टू टारगेट. And
you have to go all
there
out.
are no shortcuts here. Okay, sir, tell me some 2-day course which can cover everything with, so these are all, this course will be done by around 35-40 teachers who will be teaching you live. So 40 teachers जो पढ़ाएंगे, अलग अलग स्पेशलिटीज के अपने कॉन्सेप्ट्स बताएंगे, कीवर्ड बताएंगे. They will build your auditory and visual memory.
True.
These things will help in you recall during the exam and help you to perform better and better. Every passing month you will see number of corrects in your GTs will start improving. And by the time you reach the July, you will be at the peak of your performance.
See, everything is a process, not magic, right? So
trust the process.
Yes, you trust the process. You be consistent. You be positive about the outcomes, and that's what we can do from our side, and that's what we should do from our side. Whenever you want to make use of an opportunity, you recognize the opportunity. That's the first thing. You say yes to the opportunity, and then you go all out. That's how it is going to happen. And I'm sure that with the kind of so far bringing up that you have, both in terms of family and professional life, you are strong people. You are destined to achieve more in life. You are committed to patient care, to give your best. And I don't see why there should be any reason why you should compromise on yourself. मैं हमेशा बोलती हूँ अपने जूनियर्स को कि जब आप OPD में होते हो, इमरजेंसी में होते हो, OT में होते हो, आप कभी नहीं सोचते कि ये पेशेंट मुझसे रिलेटेड है कि नहीं है. एंड यू गो एंड डू एवरीथिंग फॉर दैट पेशेंट, फ्रॉम रनिंग अराउंड टू गेटिंग रिपोर्ट्स टू हेल्पिंग देम विद मेनी थिंग्स. You forget even to have lunch and dinner. That is what you're doing for a person who you don't even know who that person is. They're not related to you. So when you go all out for someone else, why can't you go out for your own self? Why should you compromise? You shouldn't. It is an investment into your own life. You deserve it from your side. So I always say, start truthfully, be committed to your cause, and have good intentions, have positivity. Only positivity doesn't work. You have to work for things practically as well, right?
अपना एंड में ना, I'll just show you the DAMS diary. This is the DAMS official diary which many students use for the wrong diary. Are you able to see it? So
I think yes.
On this one side you will see January and this is July, and बीच में ना एक काजम है. ये इसमें जो करोगे ना, अगर कुछ करोगे तो ये ब्रिज बन जाएगा, नहीं तो नहीं बनेगा. And this bridge will be formed by concepts, ultimate live class, questions, DQB, GOAT edition, टेस्ट, क्लास टेस्ट, SWT, ग्रैंड टेस्ट, रिवीजन, DVT. बस और कुछ भी नहीं करना. दिस विल बी योर ब्रिज टू क्रॉस दिस काजम. उसके साथ ना माइंडसेट चाहिए. तो मैंने क्या किया, डायरी के ना ऊपर माइंडसेट लिख दिया. और वो माइंडसेट ना, आई एम श्योर आपने अब तक देखा ही होगा और हमने कई बार बोला भी है कि ना, हमें लगता है कि कुछ जादू से टाइम आ जाएगा
या कोई और कर देगा,
लेकिन होता नहीं, कभी भी नहीं होता यार. हमारे साथ ही नहीं होता, किसी के साथ भी नहीं होता. करना तो खुद ही पड़ता है. तो एक लाइन है जो मेरे खुद के लिए बहुत ज़रूरी है. मैं चाहता हूँ हम सब मिलके आज दोबारा बोलेंगे, और चैट बॉक्स में बोल के भी बताएंगे अपना टाइम अपन
खुद लाएगा।